Hello and welcome. My name is Laurie Smith, and I'm the Community Initiatives Coordinator for Atlantic Prevention Resources. I coordinate the Substance Misuse Prevention Coalition, Join Together Atlantic County, and am the Kayak Chair, as well as the Atlantic County Youth Prevention Specialist for our Partnership for Success grant from the New Jersey Department of Human Services, Division of Mental Health and Addiction Services. This presentation is taking the place of the scheduled Atlantic County Education and Youth Services Committee meeting. Today is session 1 of what has traditionally been part of a slide program delivered in schools for staff and administrators. We are breaking down that presentation into multiple virtual sessions that are being recorded and will be posted to the JTAC website. We are asking all participants to please remain muted throughout the presentation and feel free to turn off your camera as well. At the end of the session, an evaluation link will be posted in the chat box. We ask that you please complete that evaluation. Also, attendees will receive an email allowing you to submit questions for the speakers. The questions you submit will be used to create a frequently asked questions fact sheet and also shared with attendees and posted to the JTAC website. Our first presenter today will be Catherine Saxton Granado, Senior Program Development Specialist Coordinator for the Children's Interagency Coordinating Council. Next will be Lisa Polite, Program Coordinator of the Children's Crisis Mobile Response and Stabilization Services. Then John Roy, Community Resource Administrator of Care Management Organization. And finally, Robert Schober, Executive Director of our local family support organization. I will now turn it over to Kathy to begin our presentations.
Thank you, Laurie. On our first slide, roles and responsibilities, we're going to start by just taking a look at how the system is structured. We want to introduce some of the acronyms that unfortunately are part of the service system. So looking at the flow chart, to the left we have the Department of Children and Families, often referred to as DCF. We also have CSOC, which represents Children's System of Care. We have Perform Care, and then we have our local partners, the CMO, which is the Care Management Organization, MRSS, or Mobile Response, which stands for Mobile Response and Stabilization Services, and we also have the FSO, which is our Family Support Organization. So how does this work? The New Jersey Department of Children and Families contracts with Perform Care to provide access to publicly funded services through the Children's System of Care for youth up to age 21. The Children's System of Care is committed to service provision based on the youth and family needs in a family-centered, community-based environment. The Children's System of Care encompasses state staff who are charged with management and oversight of the administrative, clinical, and support services provided by agencies contracted with the Department of Children and Families. Perform Care is the contracted system administrator for the Children's System of Care, and as such is the single point of entry and access to a variety of services for youth and families throughout New Jersey. The Children's System of Care. Feedback tells us that the Children's System of Care is a somewhat hidden system of services, although that isn't the intention. The System of Care is a statewide, coordinated network of services and supports that relies on youth and families being at the center of their own care and aims to support youth and families within the community and with an approach that is mindful of cultural context and awareness of the social determinants of health and how these can impact families. It is important to note youth do not need to be involved with any other system to access Children's System of Care services. The Children's System of Care has contracts and provider agreement arrangements that support service delivery. Contract services are reimbursed with federal and state funds. Now we'll watch the Children's System of Care's new public service announcement.
Growing up can be tough on kids. So much is going on in the world that can trigger depression, anxiety, substance use, or acting out. Sometimes parents or friends just don't understand or can't relate, and the emotional distance becomes hard to bridge. We all know kids can have bad days, but trauma and life-changing events can have a lasting negative impact. Atypical or unusual behaviors that continue for more than 6 months could indicate a need for help. Don't wait. For real-time support, resources, or de-escalation counseling, call New Jersey's Children's System of Care. It's the state's low or no-cost behavioral health system for all kids up to age 21. CSOC provides free, coordinated access to mental health supports, substance use treatment, and services for intellectual or developmental disabilities. Call now, 1-877-652-7624. That's 1-877-652-7624.
This is the first time a public service announcement has been created about New Jersey's Children's System of Care. We're happy to share this public service announcement, which fits perfectly and supports our goal of unlocking information about unknown or overlooked services. I'll put a link in the chat, or we can forward the link afterwards, because this PSA is available for schools and youth-serving organizations to use on the resource areas of their websites. So what is Perform Care? Perform Care is really a portal. In New Jersey, Perform Care is a full-service behavioral health managed care company serving members in the public and private sector. It works in partnership with our New Jersey Children's System of Care. We now have a second video that summarizes how youth and families access New Jersey's Children's System of Care services through Perform Care. This video is also available on Perform Care's website.
Sometimes it can be hard to tell the difference between what may be normal for your child and when you should reach out for extra help. If your child is struggling with emotional and behavioral healthcare needs, intellectual and developmental disabilities, or substance use challenges, the New Jersey Children's System of Care and Perform Care are ready to help you and your family when you call 1-877-652-7624. Since 2001, the Children's System of Care has been connecting New Jersey's families and young people to the care they need by helping them access publicly funded services for youth up to age 21 through the statewide New Jersey Children's System of Care. Perform Care can assist your family when your child is impacted by depression, trauma, bullying, violence, defiant behavior, drug or alcohol use, developmental disabilities such as autism, Down syndrome, or cerebral palsy. We are available to help you 24 hours a day, 7 days a week, and 365 days a year at 1-877-652-7624. There is no charge for calling Perform Care. When you call Perform Care, you will be connected to a trained associate who will ask for some information about you and the child you are calling about so they can best assist you, such as the reasons for your call, your child's date of birth, and address. If your child is in crisis, Perform Care can send a clinician to your home or to an agreed-upon location in the community within an hour to help stabilize the situation and offer additional services as needed. In addition, Perform Care can help you locate the nearest psychiatric screening center or contact emergency services. Other available services include referring a child for assessment, where an independently licensed clinician can come to the home and review your child's biological, psychological, and social factors. Perform Care can also refer you to community services and/or recommendations for outpatient services. Substance use treatment services, referrals, and authorizations are available through Perform Care for eligible youth. The Children's System of Care also offers services for youth impacted by intellectual and developmental disabilities. The first step to accessing these services is to apply for eligibility for developmental disability services. Specially trained Perform Care associates are available to help explain the process. At the end of your call to Perform Care, you can expect an explanation of any services being authorized or recommended, as well as the next steps. You will also receive a letter in the mail explaining the service or services you have been authorized to receive. Beginning with just a phone call, Perform Care can help you connect your child to the behavioral health, substance use, or developmental disability service he or she needs to be well and thrive. We are available 24 hours a day, 7 days a week, and 365 days a year at 1-877-652-7624.
So let's review a little bit of that. Some of the important points is that access to care is available 24 hours a day, 7 days a week, and 365 days out of the year. Some of the highlights of the video involve the purpose of Perform Care, which is facilitation. And the idea is that it's a one-stop access point for youth and families in need of behavioral health, substance use, and intellectual disability services. Some common reasons for referrals or calls to Perform Care include concerns about youth struggling with depression and anxiety, youth who exhibit physical or verbal aggression, concerned about youth who are struggling with behavioral symptoms, including hyperactivity, inattentiveness, oppositional or defiant behaviors, with a goal of getting help for youth who are either engaging in bullying or being bullied, getting help for youth who are struggling with grief, loss, or any form of trauma. Calls to Perform Care can also be made to assist family members or teaching staff who have concerns about a youth's functioning in school or in the community. The Children's System of Care Service Array. We're now going to hear in a few minutes from our core community services, Mobile Response and Stabilization, the Care Management Organization, and the Family Support Organization. The Children's System of Care contracts with agencies for each of these system partners. So each county has an agency under contract as either the Care Management Organization, as Mobile Response and Stabilization, and for the Family Support Organization. This community and network of supports allows an opportunity for earlier intervention and coordinated community-based care, which is driven by family need. These partners operate within a wraparound model and a system of care approach, as well as with a core approach of trauma-informed care and healing-centered practice.
Thank you, Kathy. Next is Lisa Polite of the Children's Crisis Mobile Response and Stabilization Services.
Thank you, Lori. As Lori said, my name is Lisa Polite, and I have the privilege of working for the Children's Mobile Response and Stabilization Services program. Our program at Mobile Response is really designed to help the youth and families who are vulnerable to or experiencing a broad range of stressors, coping challenges, variety of emotional and behavioral needs or symptoms, such as the ones that were mentioned in the video. Our program, again, is really designed to respond to all different kinds of circumstances that might come up for youth up to age 21 in the community. Some of the situations that we've responded to before have been youth substance use, coping with any kind of stressful or traumatic life events that have occurred, feelings of isolation, communication challenges, suicidal thoughts and ideations, youth exhibiting oppositional defiant behaviors, challenges at home, challenges at school, family conflicts. As I mentioned, we respond to a variety of circumstances. The Mobile Response Program is the Children's System of Care timely face-to-face community-based response component. Our program at Mobile Response is available 24 hours a day, 7 days a week, and we can provide a response up to an hour of the call to our program, or it can be delayed for a period of up to 24 hours when families contact. And especially at this time during the public health emergency, our program is also able to provide a telehealth outreach where we do a telehealth dispatch with the family if that's what the family prefers at this time. The mobile response program is really designed to stabilize the youth and family system, kind of prevent any unnecessary interventions such as emergency room visits, psychiatric emergency room visits, prevent any unnecessary involvement with the child protection and resource care placement, and with the youth justice system. Again, the goal really is to help the youth be safe at home, in the community, and school whenever that's possible. One important thing to note, though, is while our program is designed to provide intervention within the community, mobile response is not a substitute for any psychiatric emergency services, which are designed to assess for imminent risk of imminent risk to self, others, property, and to facilitate hospitalization. That's not what we do. New Jersey has 15 different mobile response programs that cover the 21 counties in the state of New Jersey, and that's what allows for the timely and flexibility of the response. Families can access, again, mobile response 24 hours a day, 7 days a week by calling the number for Perform Care, regardless as to where they are in the state of New Jersey. And again, what's important to note is that the legal guardian has to provide the consent for the mobile response contact. Just a few more things. I'm sorry, as the phone's ringing. I want to wait until it stops ringing. Thank you. So just a few more things to note about the program is that our crisis intervention specialists are bachelor's or master's prepared individuals who are supervised by a licensed clinician. The work that the crisis intervention specialist does is to really de-escalate that immediate crisis situation as necessary, and then engage the youth and families in a process that's going to help them understand their needs, learn new skills, and plan for managing the needs with their supports in place to help prevent any future escalation. The focus is really building connections to the strengths, supports, and services to help the youth and families thrive in the community. We can provide either a 72-hour period of crisis stabilization and case management, or a period of up to 8 weeks within our program and services. Thank you.
Thank you, Lisa. Next, we have John Roy of Care Management Organization.
Thank you, Lori. Hi, yes, this is John Roy. I'm the Community Resource Administrator for one of the 15 CMOs statewide, and our CMO is Cape Atlantic Integrated Network for Kids. The reasons why there are 15 CMOs and 15 mobile responses and 15 FSOs, as opposed to 21, they built this system based upon the court system's vicinage contracts. And so therefore, that's why it's Cape Atlantic. Cape Atlantic shares a core business with Cape Mid-Atlantic. Now, with that said, everyone has access to the CMOs in Cape Mid-Atlantic County based upon needs, and as if the individual is struggling with behavioral, emotional, substance use, or intellectual developmental challenges, that's one thing they can do is contact that Perform Care number. And once that's done, the CMOs are always the Children's System of Care local lead system partner, providing comprehensive care coordination and planning for youth and their families with moderate and complex needs through the wraparound model. The wraparound model is an evidence-based model that was set up early in the 90s to make certain that the services were identified through the different systems that you can access for Perform Care. An average length of stay involvement with the CMO is between 12 and 16 months. That's what the state's guideline is. As of this past quarter, Cape Atlantic has an average length of stay of 10.3 months. So we're well within that guideline. And what we do with this, the CMO works with the youth and the families on building a comprehensive, supportive team as they drive their own teaming and planning process to address their identified needs. The CMO services are available to youth and their families whenever the need meets or presents itself during the development process. This evidence-based practice, the wraparound model, is an intensive individual care planning and management process. The model brings together the family, professionals such as yourself. It's always key that families are connected or give us permission to have access to the schools. And we do that when we do our meet and greets, we get all the release of information signed that allows us to share information. With this building of the team, I talk about the professionals, I talk about the families, I talk about the informal supports. Those informal supports are folks like the youth softball coach or a faith-based individual, someone who knows something about the families. Those informal supports are supposed to be there much longer because they're not paid supports, something the family can rely on whenever they're there. Youth and family voice is always integral in this process. Caregivers are connected to the family peer support partners that Rob Shover will talk about through the Family Support Organization. And what they would do is when they engage with the CMO to co-facilitate the wraparound process and support the family voice in this process. The CMO's frontline care managers' work is to engage with and build relationships with the youth and the families to support assessments of strengths and prioritizing the needs identified by that process of the child family team. The collaboration with youth and families to develop their own child family teams. The child family team members include anyone the youth and the family identify as important connections for their support. The care management organizations guides the work of organizing CFTs and facilitating team meetings to support the ongoing assessment and planning process. The team works collaboratively to assess and prioritize the needs, identifying strength-based strategies, and implement individualized plans, supports, and services that will help the youth and families meet their obvious goal as well as their family's vision. The child family team can access supports and services, including the entire children's system of care array of services, coordinate insurance benefits when available or if needed, and access community supports not typically funded through Medicaid or insurance. And remember, the CMO aims to maintain youth in the community for the treatment whenever possible. That's the most least restrictive area. And the state wants us to have at least an 88% of the families remaining in their community receiving services. And right now, as of the last quarter, Cape Atlantic Inc. has 89% of our total youth receiving services in their own community while they're attending their own school and with their own families. Relationships between the CMO and other providers who are involved with the youth and their family are key in this system-level collaboration. This collaboration helps foster a better understanding of the needs of the youth from other perspectives. To develop these relationships, please you can contact me, John Roy. My contact information is on that one slide. I can give you information about what our agency can do, as well as a community resource administrator. I want to make certain that you look at that first slide of the CMO and pay attention to visit our website. It's there, as well as the Cape Atlantic ResourceNet. ResourceNet has a host of resources available for anybody, as long as they just log in. And please know that each of the CMOs have a ResourceNet. At the bottom of our ResourceNet page, you can see the scrolling roll of the other resources, and you can contact those if you have friends in other counties who may need services as well. Each of the CMOs, each of us have an executive director, an operations director, and what I can do, I can make certain that Kathy has a copy of our staff list with cell phones and emails, and I can give that to her, and she can pass that on to the school. So if you do have questions, you can always contact the executive director if it's about a family based upon release of information, and we can exchange information there. But please make certain I'll get that information out to Kathy so you can have that, and I'll try to make certain that it's updated and in your presence whenever possible. Thank you, Lori.
Thank you, John. And now we have Robert Schober of the Atlantic Cape Family Support Organization.
Okay, I was able to do it. Good. Okay, and now that I'm on, thank you, Lori. And Good afternoon, everyone. It's a pleasure to be here. Family Support Organization is the Children's Systems of Care Family and Youth Peer-Driven Support Leaders. We are a locally based organization run solely by families of youth with emotional, behavioral, substance abuse issues, and intellectual or developmental challenges. So our peer or family support partners have had their own personal experiences supporting their own youth with the challenges I just mentioned. So we're able to, in ways that a lot of folks aren't, to be able to relate to the family story and what they're going through at that particular time. So we provide strength-based services which are flexible to the family's needs. And with a direct understanding of what the family is going through, the family support partner can provide direct in-person or remote support to families, assisting them to navigate the children's system of care. Because of the pandemic, we obviously aren't seeing folks as often in their homes, but we can arrange to do so either remotely or visit perhaps outside. Also, in conjunction with the care managers, our family support partners contribute to the children family treatment process and develop a family action plan based upon the family assessment and needs and strengths. These services are accessed through Perform Care, of course. The family is open to the family support organization at the time that the family provides consent. And we also offer other support services which are available to caregivers of youth who have needs in the community, whether they're engaged with the care management organization or not.
Okay.
These services include telephonic support during business hours, 2 support meetings per week, including a general meeting and a women to women group. And when we return in person, we'll begin to host our grandparent raising grandchildren meeting. We also offer classes in parenting skills, including the Nurtured Heart approach and active parenting. Additionally, we provide families with educational workshops and can assist the family to navigate the IEP process as well. Our family support organization is also available to assist families who are involved specifically with mobile response and stabilization services, providing the family is seeking our assistance. Also, we have a group called the Youth Partnership Meeting, which is a group of young adults who are between 13 and 21 years of age, who meet twice a week in a semi-structured opportunity to develop social skills and decrease social isolation. The YP provides self-help and encouragement, and at the same time, our members give back and they volunteer at different organizations of their choice. So currently, they're assisting the Funny Farm Animal Rescue Program over in Mays Landing. And when feasible, we also are able to organize trips, for example, to David and Buster's, a camp up in North Jersey. We've been to Washington, DC, and other points of interest. In summary, our services can be accessed by families directly by contacting the local family support organization here in Northfield, or by referral from the Cape Atlantic Inc. We can be found on the Perform website, our own website, which I'll put in the chat. We're also on Facebook and Instagram, and all of our services are provided in Spanish and are also free. So with that, I'll return it to Kathy Granado. Thank you.
Thank you, Rob. One of our goals at the beginning was to talk about the system of care and the partners that are involved. And another one of our goals was to talk about local connections and partnerships. The Children's Interagency Coordinating Council is a local partner. Every county has a Children's Interagency Coordinating Council, or CIAC. These are local planning bodies that foster cross-system service planning for youth residing in their county. CIACs provide a multidisciplinary forum to develop and maintain a responsive, accessible, and integrated system of care for youth and their families. The CIACs serve in an advisory capacity to both county government and to the Department of Children and Families. They're facilitated by a local CIAC convener or coordinator. They're funded through the Children's System of Care, and membership includes families, local system partners, including our CMO, our mobile response, and our FSO. Community-based organizations are included, county planting entities, and sometimes state representatives are included. They identify needs and they address barriers to effective service delivery and make recommendations on programs and policies to ensure a comprehensive system of needed services within the county is maintained. CIACs have several subcommittees. One subcommittee found in all 21 CIACs is the Education Partnership. Education partnerships are alliances between local school districts and local agencies that serve youth and families. These partnerships provide cross-system training and help direct resources and services from DCF and information to other sources to families in need. These partnerships serve as a forum for local school personnel, for DCF staff, and local service providers to not only cross-train, but to also help agencies understand how they fit together in the local system of care to support youth and families. The Atlantic County CIAC meets bi-monthly at present, virtually. And if you have not had an opportunity to attend the Atlantic County Education and Youth Services Committee meetings, I encourage you to contact me. Community members are also encouraged to attend these bi-monthly full council meetings and can contact me for more information.
Thank you, Kathy, and thank you to all of the presenters today. An evaluation link has been posted in the chat box. Please take a moment to complete that so we have feedback for our future presentations. Participants in our live recording will receive an email inviting you to submit questions for our presenters. If you have watched the recorded version of this presentation through our website, you will see a question box below the recording, so you may submit questions there as well. We will email all attendees the information for future presentations, as well as the link to the archive presentations on our JTAC website. Thank you all and have a great day.